Okay, good morning, everyone. My name is Garrett Sheehan. We'll get started in just a moment. We'll let people get into the webinar, and then we'll get underway. Thanks. All right, good morning, everyone. My name is Garrett Sheehan. I'm President and CEO of the Greater New Haven Chamber of Commerce and Quinnipiac Chamber of Commerce. We're very pleased to bring you a special webinar this morning where we stand on the virus, an update on how to protect your employees and customers, also about testing, so much different information out there. And we just kind of want to reset the picture and talk about where we stand in Connecticut and the things we need to keep doing as we move forward to maintain the position that we have. Before we get started, I again always want to thank UI, Connecticut Natural Gas, Southern Connecticut Gas for their support of the Chamber, and especially a grant that they provided us to be able to put on this programming over the last several months and going forward. And then also all of our investors in the Chamber. You see their logos here on the screen. These are the companies make tremendous investment in the Chamber and have allowed us to be able to put on programming like this, but also just provide business assistance as we've moved forward over the last several months now. Excited to welcome in our two guests. I think it speaks to how long we've been doing this for, because they're both on for a second time now. Josh Geballe, Chief Operating Officer for the state of Connecticut, and Dr. Stephen Choi, Chief Quality Officer and Associate Dean for Clinical Quality, also Vice President and Chief Quality Officer for the Yale New Haven Health System. Stephen, Josh, thank you again for joining us. Appreciate it. And I hope at some point we'll get away from doing these, but in the meantime, it's been good, and the updates that you guys are able to provide for us, the business community, have been extremely helpful. So, Dr. Choi, I'll start off with you. We watch the numbers every day, and as impressive as it has been to see the positive tests go down, the hospitalizations even more significant, just because we know so many fewer people in the hospital. What can you tell us about where we stand on the virus?
Sure, and thanks, Garrett, for having me, and it's great to see Josh again. So as you noted, our hospitalizations continue to go down. I think last I checked, it was last night, we had just a little over 120 patients across the state in hospitals. And I think that's an incredible testament to what our community has done in terms of adherence to the guidance that both the state, the governor, Josh's office, all the health systems and the health departments around the state have been endorsing really since March, and I think without that we would not have had the success that we are continuing to see, particularly in the last several weeks. So as you know, the hospitalizations will always lag behind the numbers of people who get infected, or at least the rate of infection. And then after hospitalizations, obviously the ICU patients and unfortunately the patient mortalities are the sort of most lagging indicators. And so those numbers seem very, very promising thus far. And we're pretty confident now that this, the weather, particularly the warmer climates, being outside does seem to be an advantage in terms of mitigating transmission. As you can imagine, after Memorial Day, many of us, I know Josh and his team were probably pretty anxious about what we're going to see in the hospitals, but we didn't see that spike, and I think in large part it's because the people in the state, for the most part, are adhering to those practices. So, if there's one thing that I could share with the audience here is that please continue doing what you did, which is the social distancing practices. I'd like to use the simple abbreviation of the 3 Ds, which is distance, duration, and density. So as much as possible, keep 6 feet away. That's your distance. Try to minimize the duration. So we know that this virus primarily gets transmitted with close physical contact for a significant duration. And the CDC is now saying, probably around 10 minutes. So it doesn't mean you can be in close proximity with anyone for 10 minutes, but, try to limit that duration as much as possible. And then density is the third D. Limit the total number of people that you're in contact with. So, rather than, convening with, dozens of people, try to limit that contact with a small number of people. And I can't emphasize enough how important wearing a mask is out in public. We are very confident now that the safest place in the public domain to have the lowest risk of transmission is ironically the hospital. We have the lowest rates of transmission because everyone is required to wear a mask. So if you remember, wearing a mask it's not for you, it's for others. And so if you keep repeating that, is that if we all wear a mask, that we can all contribute to the safety of, our fellow colleagues, our loved ones, our friends, and our neighbors. And, you got to continue that strict hand hygiene. So that would be my summary of things. And we'll see how the rest of the summer pans out. I know many of us are anxious about, the southern states, some of the states in the South and Southwest, but, fingers crossed, we'll continue behaving.
Thanks, Dr. Choi. And I should let everyone know, if you have questions, you can start putting those in the chat and we'll get through those. I'll welcome in Josh. And Josh, I guess if there's one thing we've learned is we're still constantly learning with this virus. And, it's a great success for the people of Connecticut, for the governor's leadership on this, that we are where we are right now, but that can change quickly as we've seen. You've been running point on this since the beginning. What's your overview and thoughts about where we are right now?
Yeah, thanks, Garrett, and good to be with you, and also Dr. Choi. I think last time Dr. Choi and I were together was, I think it was in the middle of April. We were at Southern Connecticut State University at the field house,
right,
opening up, with the Army Corps or the National Guard mobile field hospital. As the cases were really spiking, the hospitals were filling up. We didn't really know how bad this was going to get. We thought we were doing the right things to try to slow it down, but we really didn't know at the time. And fortunately, those actions worked. I mean, there was a tremendous amount of sacrifice by a lot of people in the state. And that's not lost on any of us, but I think that the good news is clearly that those actions did bend the curve. The metrics have come down dramatically. We're now at about 1.4% test positivity rate over the last 7 days, which is among the lowest in the nation. As Dr. Choi mentioned, the hospitalizations have fallen off dramatically. The rate of transmission is also one of the lowest in the nation. So today we're in a good place. That said, two things. One, people need to remember that COVID is not gone from Connecticut. We still are testing, roughly 100 people positive in the state a day. We still have a couple dozen people presenting at our acute care hospitals, COVID positive every day. This is a disease that's not going to go to zero, until we get to the point where we have a vaccine or we have other therapeutic interventions that can help us. And so, the most important message, as Dr. Choi mentioned, is that we cannot let our guard down. We cannot take for granted that just because the numbers are low right now, that they're going to stay there. You don't have to look far around this country right now to see what happens if you don't do the things that Dr. Choi mentioned: wear the masks, practice the social distancing, follow the guidelines, generally just be smart about how we control this disease. I think we've learned a lot about it now to know what we need to do. And we just need to make sure that people don't get complacent and don't think that these low infection rates are something that are guaranteed. They're certainly not. So, but I definitely want to thank everybody for their support of the guidelines we've put out, the very difficult measures we've put in place. We are at a point now where we've got about 95% of the economy able to be open. We know that we're not operating at that level now because there's a lot of restrictions on capacity and other things to try to prevent resurgences, but we're trying to do our best to maintain this balance between keeping the virus transmission at as low a level as possible, but still enable people to get back to work, enable businesses to try to mitigate some of the challenges that they've experienced in the last several months. and try to find some balance here that we can maintain going forward. Also looking forward to the end of the summer, knowing how important it is to get kids back to school in the fall. And that'll be the key focus of our the governor's press conference this afternoon. So it's a quick overview, Garrett, and I'm happy to take questions.
And Josh, I know you're on top of all the different metrics, all the different activities out there. What is it that concerns you the most, even knowing we're gone to an okay spot right now, but as we continue to go forward, what's the thing that keeps you up at night, continuing to think about how this virus progresses?
Yeah, I mean, I think there's several things. I think it's, like I said, people getting complacent, people stop wearing the masks in crowded areas, not doing the social distancing, not following the guidelines. I think if we can follow the guidelines and do those things, we've got a very good chance to keep this under control. I worry about the other parts of the nation too, right? Where we see significant flare-ups. I think the United States set the all-time record yesterday for most positive cases. Obviously it's New England and New York and New Jersey. We're all as a region in a good spot right now, but we're worried about travel. And so folks probably saw we put in place a travel advisory yesterday with our neighboring states to request that people who are traveling in from specific states that are experiencing significant flare-ups to self-quarantine when they arrive in Connecticut for 14 days to help us try to ensure that we're not reintroducing the virus from other places coming in on planes or traveling in as much as possible. So that's another important area.
Dr. Choi, as we've gone through the progression of the virus here, our understanding of how it's transmitted has changed. I know you mentioned the masks. Is that the number one preventive measure? And I guess I'll anecdotally say, I mean, the one thing I've seen just from watching the news over the last several weeks, it seems like in Connecticut, we've kind of adopted that mask culture. Maybe that's one of the things that other parts of the country hasn't taken hold, but it does seem like that's helped us here.
Yeah, no, and I think, Josh and the governor's office have done a tremendous job, communicating and iterating how important that is. But absolutely, the mask and also the hand hygiene. And it's because as you breathe, you talk, you cough, you laugh, you have respiratory droplets, and wearing the mask will prohibit you from spreading it throughout the proximity of others. So that's why it's effective. But the hand hygiene is absolutely critical too, because someone could touch a surface where there's an infected droplet, and then by touching that surface and then touching his or her face, they can get infected with COVID. So it's really the combination of the two. And I also want to iterate to the public, this gives me a lot of angina when I'm out and see people wearing the mask. The mask is ineffective if you're wearing it below your nose. And I know it's very uncomfortable. It could get hot. It's difficult to breathe, but you can't wear a mask and have it below your nose or just above your upper lip. That's really not effective. And so, we want you to wear it, so that you have a fairly good seal around the bridge of your nose and throughout your entire mouth. And I know some people have asked, well, should we be wearing gloves? Well, I recommend against wearing gloves, because once you wear gloves, you got to keep taking it off if you if you touch your face with your gloves, and it's a lot easier to remember to wash your hands while you don't have gloves on. So I think just wearing that mask is very, very effective.
And any just general advice we've had, as Josh mentioned, the reopenings have been occurring. So as businesses have gone up and started, and they're trying to navigate, how do I do this task or this activity within my business that I used to do, and what's the safest? I mean, just at the chamber, we've tried to say, use common sense, think about, how transmission spreads, but just any general thoughts about what businesses should do to continue to protect their employees and customers?
Absolutely, and I'm glad you distinguish, customers and employees, because there's unique approaches to both. So let's start with our customers. Customers always come first, but I think it's absolutely essential that, particularly for the indoor businesses that are going to allow customers to come in, is that you have to require that they all wear a mask. And I think, in Connecticut, I'd be really, really shocked to discover if anyone didn't have a mask at hand. Most people have masks in their car or they carry it in their pockets. So every single customer should come in with a mask if they want to enter that place of business. Number two, you should mark the locations in the store so that you can have a designated space or distance by which the customers move throughout the store. So for those of you who've gone to, let's say, Trader Joe's or ice cream store, a lot of those businesses have footprints of where you should be standing. And it's a reminder for customers to say, hey, if you're going to go through a store, just walk through this path, but don't get too close. And here's the length at which we believe is safe. Number three, I would have as much alcohol dispensers as possible available at the store so people can remind themselves to wash hands. And that was a big turning point for us in U.S. hospitals. There was a time not that long ago that we may have had one alcohol dispenser in the entire unit of, let's say, 35 beds. But over the last 10 years, we put alcohol, hand sanitizer dispensers inside and outside of every single patient room. And that alone drastically reduced the number of hospital-acquired infections. So those are the key measures to protect, the customers. For your employees, I think it's essential to screen your employees. It can be viewed as somewhat intrusive, but making sure you do temperature checks, twice a day, particularly for those shifts that are long. But upon entry, you should do a temperature check. If it's above 100 degrees, I would recommend that they get sent home, and I would say a minimum of 3 days without fever, or 3 days since the last fever is the earliest they can return, assuming that they don't have other symptoms consistent with COVID. And I know Josh will talk about testing, but right now the state's capacity to test is astronomically higher than where we were, back in March. It's become a real game changer, and obviously, that could have made a big impact if we had the resources back then. But making sure that you really wipe down the high touch surfaces in your workplace is absolutely critical. And, you don't have to buy fancy, disinfectants, good soap and water or a solution with 70% alcohol or a diluted bleach solution is fantastic. And I think wiping down those high touch surface areas frequently and regularly is better than just wiping down the entire store or the entire business just once a week. So if you can do this, on every shift, wipe down those, the doorknobs, the handles, certainly the bathrooms, the chairs, the tables, the rails, where you're going to have a lot of customers coming in and out, touching, grabbing surfaces where people can, potentially contaminate those locations. It's absolutely essential. And then, of course, it goes without saying that the employees, the employers, business owners, they should also be wearing a mask as well, too.
And Josh, as far as testing, that was something we talked about all the time when we first got started with this. I know the testing has ramped up tremendously. In one of our other sessions, we talked about some of the just local Connecticut companies that have supported that effort, and it's been great to see that. Where do we stand right now in Connecticut on testing, and how do you see that going forward?
Yeah, so as Dr. Choi mentioned, we are in a much better place as a state right now than we were in the early days. We've worked hard to partner with a number of labs in the state, as well as hospitals and healthcare providers to really ramp up our testing capacity. We're now at a point, it's interesting over the last couple of weeks, whereas the infection rates have come down, we have a lot less sick people in the state right now. We actually have far more testing capacity in Connecticut than we're using at the moment. And some of that is obviously good news. Like I said, a lot less sick people getting tested, a lot less positive cases. But we do want to see more testing than we're seeing right now. And the state has been working hard to try to focus testing not just on people with symptoms, but also people who are healthy, asymptomatic, in the most high-risk areas. So, for example, nursing homes, assisted living facilities, which I think people are aware has been the source of the greatest impact so far in this pandemic. We put in place an executive order a couple weeks ago mandating actually repetitive testing of everyone in those facilities who, whether they have symptoms or not, really looking to root COVID completely out of those facilities. That testing began, a number of weeks ago, but we've now shifted to make it completely mandatory and repetitive. Similar approach in our prisons, where we saw many fewer fatalities, but still quite a bit of infection, very high risk environment, people living together, sharing bathrooms, congregate settings. So focusing a lot of testing there, other large congregate settings. And then a particular focus in our cities. I think everyone is aware at this point that density, plays a major role in transmission here, and our cities have been disproportionately impacted. We have a higher percentage of minorities in those communities who've been, the numbers speak very clearly that they've been disproportionately impacted. We've got a lot of essential workers who don't have the luxury to telecommute or to work from home. A lot of people who are maybe living in a home where if they do have symptoms or they do get COVID, they don't have as much ability to self-isolate from the rest of their family members. And so we're really flooding the cities with testing as well. Some very creative partnerships with our federally qualified health centers, with our health systems like Yale, to go to churches, to go to homeless shelters, to go to all sorts of housing developments where we're going to bring the testing right to people and try to make it as easy as possible for people to get tested, even if they feel healthy. But I think the main message for everybody here is just to really continue to help us beat this drum. Even if you have very mild symptoms, err on the side of getting tested. Don't hesitate. There's so much testing available. It's free. We've got 139 testing sites around the state right now. You can go on 211 website, punch in your zip code, and I'd be shocked if you can't find a testing site within about a 10-minute drive at the most. It also lists on there which sites will take a test for you, even if you have no symptoms. So there's a lot of questions often about asymptomatic testing. So the website at 211 will indicate very clearly where you can go to get a test, even if you don't have symptoms. So please just keep beating that drum, especially if you've got yourself, employees, family members, any even mild symptoms, go get tested. And then the other piece of this is we've been ramping up a statewide contact tracing process. If you are contacted through that directly, or just through a friend who tests positive, a coworker who tests positive through contact tracing, encourage all those close contacts to go out and get tested immediately as well, and take appropriate medical guidance to self-isolate for the appropriate time. And those are the actions we can all take that can help keep COVID under control here in Connecticut.
And Josh, I just want to be clear for everyone, because I get a lot of questions on this too. So if you don't have symptoms, there are places where you can be tested. Go to the website, find those out. But there are locations, but that's just not every location. So you can't just roll up at where you hear there's a testing facility. So check out the website to find out where to go if you want to get tested, even if you don't have symptoms, right? And Dr. Choi, picking up on something Josh said, and it's always very easy for us all to say, if you are sick, don't go to work. But I think in all of our lives, we've found it difficult when you feel just a little bit off, and am I really sick? Am I not? I would guess that on this, always err on the side of, if you feel any off at all, assume that you may have this.
Absolutely. And, I think globally around the world, when we were approaching this disease, we were kind of stuck in this sort of trap that, you had to have a fever and you had to have a cough. And we're talking just 3-4 months ago. And I'm going to tell you right now that the spectrum of symptoms that you can present with if you're infected with COVID has quadrupled in terms of what different symptoms you can have. So you can just have some mild muscle aches. You could just have a little bit of vomiting, diarrhea. I'm sure everyone knows now you could temporarily lose, taste and smell. So, thinking that it's just going to present with a cough and fever, is very, very misleading. So absolutely, you want to err on the side of caution. And that's another thing that business owners can do is to really encourage their employees that they should be very forthright and transparent about what they're feeling like, and that if they are having any of these symptoms, that they should stay home and not come in and potentially infect their coworkers as well as their customers. So yeah, I think that screening, in addition to the temperature, does include screening for symptoms.
Couple questions here, and I think I'll direct both of them at you. Can testing be done to reduce the 2-week quarantine period? And then kind of along the same line, someone was asking, before they bring remote workers back to work, should they ask that they all be tested beforehand?
Yeah, so the CDC does have a testing pathway to come back to work. But right now, we're saying, the safest thing is to wait out those 10 days. So 10 days from the onset of symptoms, and then at least 3 days where you don't have a fever. So it could be, it could be 11, 12, 14 days, because you're from the time you tested positive or time that you started getting sick, you may still have that persistent fever. So, we really recommend the 10 plus 3, which is 10 days from onset to 3 days, with at least 3 days minimum of no fever as well. In terms of the quarantine, I think, Josh could talk about what we're planning to do for quarantine right now. We're recommending 2 weeks, if you're coming from any of those states that are high risk. And also the CDC is recommending 2 weeks of quarantine if you've been exposed to someone that is known COVID positive. And the risk of just doing testing, Garrett, is that, if you were exposed today, you got tested, you may test negative and then have this false reassurance that, I'm fine, but within 3 to 5 days, or maybe even longer, you may actually test positive. I mean, you may become symptomatic, or you may have enough of a viral load that you're shedding. So, the early testing may have missed that. So that's why, we're trying to recommend on, erring towards that, 10 days of self-quarantine, and then 14 days if you're coming in for those areas, or if you've been exposed to someone, who does have a laboratory confirmed positive COVID test.
Josh, a big tension throughout all of this has been the economy, and obviously controlling the virus, and I'll just say to all businesses, let's keep doing the right things so we don't have to go back to where we were before. But maybe you could just talk about that tension. I've heard some other governors, other states say, we're just moving forward even with the virus. Now, I think all statements are subject to change, and we obviously wouldn't say anything definitive here. But can you just talk, I guess, about how in the governor's office you've handled that tension of having so many unemployed workers wanting to get the economy back going, but at the same time handling the virus?
Yeah, this is you're touching on probably the among the most difficult decisions and trade-offs the governors had to weigh here. I think in the end, I think there's an appreciation that a couple things. One, I think most folks are aware, the governor took some decisions to keep more industries open in Connecticut throughout this than a lot of other states. We kept manufacturing open. We kept construction open. Some people criticized that at the time. I think the results have proven out that those are, those businesses took the proper precautions, and we didn't have any large scale, outbreaks in those facilities, and we were able to keep a lot of people working in the meantime. So that was good. But I think, when you talk about the service-based economy, you talk about restaurants and where a lot of the the business impacts have occurred, where a lot of the job losses have occurred. You have to have an environment where your customers feel safe to come out, right? And I look at some of these other states, and the thought that we can just forge ahead and ride it out, I really worry. And I think it's part just from a disease transmission perspective, but even from a commercial perspective, I don't think that type of environment is conducive to customers feeling comfortable coming out to go out for dinner or go to a movie. And so, I think these things very much work hand in hand, is that we have to have a public health condition in the state where people feel safe and they feel confident to go out and frequent businesses. And I think we're trying to strike that right balance here in Connecticut. And I think we're at a good spot right now for that. But, obviously we've got some other states that are running some kind of uncontrolled experiments that we're going to learn from here, and we'll see how it goes.
And Josh, obviously a lot more to come. I mean, we're very still early in this until we get a vaccine or better therapeutics, but and these other topics could take an entire webinar. Could you just touch on, thoughts on the state budget? I know that, there's different projections that are out there that are just overwhelming. And I know it won't steal his thunder. I know you said the governor this afternoon will be talking about schools. That's another, daycare is another big issues that we've heard from a lot of people.
Yeah. So I think the budget situation is going to be very challenging in Connecticut, like it is every other state, every other country, every other municipality right now. Connecticut is in a better position than many states from the perspective of we entered this with a sizable rainy day fund, one of the largest per capita in the nation. And, we do see a path to enable that to buffer the budget deficits due to, revenue tax declines, for the rest of this fiscal year and much of next. But, clearly that's not sustainable in the long run. And we're looking very hard at a number of areas where, we're going to need to, rebalance from a state perspective. We're going to need to be very careful on spending and what we're doing. And, clearly the hope is that the economy does come back and those impacts longer term are less severe. But, we're a long ways away, but we do have a bit more of a cushion than many other states. We also have, a significant amount of federal dollars that have come in to enable us to pay for a lot of the coronavirus response, so that doesn't have to come directly out of state funds. And so we're working very hard to be thoughtful and strategic in how we prioritize those dollars to stretch them as far as we can. But it's a tough environment from a budgetary perspective, clearly.
We'll start to wrap up. So Dr. Choi, one final question for you, and maybe if you want to give a final comment. If someone at a business, a location, they do have a positive test, does that mean they have to shut down, or are there steps that they can take to mitigate that and still be able to continue operations going forward?
Sure. No, that's a great question. And my default answer is that, that business owner should immediately contact their local Department of Health. And those departments, as Josh said, should be coordinating the contact tracing for that individual that does test positive. So depending on the circumstance, depending on the risk of exposure, whether, it was a high risk exposure, i.e. you've probably heard of the aerosol generating procedure / activity or process, that person may have infected quite a number of people. So again, there's no straightforward answer. It depends on the circumstances, but it's definitely it's not an absolute yes, and it's not an absolute no. And it depends on what kind of business it is. So if you've got an employee that, is working remotely, you've got everyone who's working PPE, and Department of Health deems that they don't have to do contact tracing, or at least for those individuals, then you could theoretically continue business as well too.
Thanks. And any just last thoughts? We appreciate you again coming on here and always letting us have your time to talk about these issues.
Yeah, I don't want to sound like a broken record, but please do what you were doing as much as possible over these upcoming months. We are going to see COVID in the fall and winter. There's no doubt. And rather than what we thought was going to be a second wave, this, as Josh pointed out, based on what's happening around the country, this might just be a continuation of this current wave that we're sort of seeing the downside of in Connecticut. But if people can just continue to be very vigilant about the mask wearing, social distancing, and hand hygiene will continue to be, enjoying the success we've been seeing the last month here in Connecticut.
Well, thank you. I appreciate it. And Josh, a final thought, and also maybe just one last question. I know you've been looking around the world, obviously in the United States, as to different ways that governments have been dealing with this. So any takeaways from what you've seen in what other governments have done, and just a last word this morning?
Sure. I mean, I think, again, not to continue beating the same drum, Dr. Choi said it well. I think we've seen other states, other countries beat it back and hold it back. It's by maintaining that discipline, and that's clearly what we need to do. I would just circle back to one of the earlier questions I don't think we really gave a clear answer on, which was on the travel quarantine. Can you shorten that with testing? And I think Dr. Choi, explained very clearly why that's not as safe an option as just the adhering to the quarantine period. Our public health directors in the tri-state region are talking about whether there are some options for that. We're going to be putting an FAQ document on the state website at some point today, where we will have some guidance potentially on that topic, as well as a number of others. One thing I would mention is we are likely going to have some exemptions for that mandatory quarantine for certain critical industries. So, for example, truckers, delivering food and other critical supplies are not going to be required to self-quarantine when they're coming into Connecticut to make deliveries, for example. Similarly, for critical infrastructure workforce and so forth. So we'll have some more FAQs out today that help clarify some of those points that we'll be filling in.
Great. Well, thank you again for joining us, and I'll just echo what you both have said. Is we need to stay vigilant. Far from over with this, and we don't want to see the economy go back to where we were before. So it's so critical that everyone does their part to continue on with where we are right now. Thank you again for joining us this morning.
Thank you, Gary.
Garrett.
Thanks. And I will say to everyone, we have one more webinar for tomorrow morning, our Diversity and Inclusion Council, in recognition of Pride Month, and we'll be doing that tomorrow morning at 10 a.m. Take care, everyone. Thank you.